The purpose of this webinar is to prepare each participating facility with guidelines to manage the 6 targeted clinical conditions for payment reform. Sample training policies and procedures have been developed that are evidence-based and have been established to support participating nursing facilities in the education of clinical staff. Each of the sample training policies for the 6 conditions for ATOP 2 are arranged in a uniform format: purpose, policy, staff training, nursing responsibilities, interventions, staff responsibilities for reporting and documentation, and the ATOP 2 criteria. An additional policy has been included as a requirement for ATOP 2 readiness: identifying, reporting, and documenting a resident changing condition. This policy addresses early identification of a resident changing condition in addition to assessment, reporting, and documentation of the resident changing condition using the Interact tools. This policy also includes actions to be taken when a resident's condition declines and the resident can no longer be managed in the nursing facility, or if the power of attorney or guardian requests that the resident be transferred to the hospital. The readiness review is required for all eligible long-term care facilities participating in ATOP 2. The purpose of this review is to demonstrate the ability for a facility to enhance the prevention of the 6 conditions contemplated under ATOP 2 and administer the necessary treatments at any time. Again, the 6 conditions contemplated under ATOP 2 are pneumonia, congestive heart failure, skin ulcers and cellulitis, dehydration, urinary tract infection, and COPD and asthma. Long-term care facilities do not need to meet all criteria at the time of application. However, applicants must meet criteria in order to pass the readiness review and participate in the payment reform initiative. The readiness review consists of 2 components: prevention and treatment. We will be discussing only the prevention component today. Participating facilities must demonstrate approval and compliance in prevention of the 6 conditions using evidence-based practice. ATOP has developed basic evidence-based training tools for each of the 6 conditions, which should be reviewed by your facility and provided to the facility corporation for approval. The ATOP staff will complete the essential training with all of your clinical staff on each of the 6 conditions to include nursing responsibilities such as assessment, communication, interventions, and documentation. The ATOP staff will use one of the following methods for training, depending on time permitted to complete the training: a 1 to 2 page document for each of the 6 conditions. Pneumonia and COPD asthma are in one document titled Respiratory Conditions. Training will take about 15 minutes and can be done individually or in a group setting. The second is a PowerPoint presentation on the 6 diagnoses. This training will take 30 minutes to an hour. This presentation is best done in a group setting. The third are Mosby skills online that will be used as an adjunct to the presentation for a visual and step-by-step process to train on assessment skills required for the 6 conditions. And lastly, for CNA training on the 6 conditions, a 30-minute video from LEAP training can be presented, head-to-toe inspections for CNAs, which assists CNAs with basic recognition of changes in condition using simple assessment skills. Training must be completed and documented for all clinical staffs on all shifts. The facility must ensure that all clinical staff have completed and been signed off on the necessary training. Please let ATOP staff know some times and dates to train all of your clinical staff on all shifts. Participating facilities must implement an evidence-based tool to identify early changes in a resident's condition and ongoing monitoring and treatment to prevent an acute change in condition. The Interact stopwatch tool will be used as an early clinical alert for a resident change in condition. ATOP staff will educate all nursing facility clinical staff on Interact tools. This information can be found in the ATOP 2 Changing Condition, CIC, Policy and Procedure. Participating facilities must implement and use a structured tool to document and communicate a resident's changing condition or hospital transfers. Enter the name of the tool being used and the actual date of full implementation on all units and all shifts. The Interact SBAR communication and documentation tool will be used to document and communicate a resident's change in condition to the primary or attending clinician. The ATOP staff will educate all clinical staff on the SBAR. This information can be found in the ATOP 2 Changing Condition, CIC, Policy and Procedure. Also necessary is the creation of facility-wide policy and procedure that defines the process to be followed to prevent acute changes in condition. Policies and procedures should specifically identify, but not be limited to, the 6 targeted conditions. Also, Policies and procedures must describe the facility's process to transfer a beneficiary to the hospital. An example is when the beneficiary cannot be safely treated in the facility upon the physician's orders at the beneficiary's or healthcare proxy's discretion. Information to meet these readiness criteria can be found in the ATOP 2 Changing Condition Policy and Procedure. All policies can be found on the ATOP 2 website, atop2.org. For questions relating to the readiness review criteria, contact Deb Himes at dhimes@healthinsight.org.